Okay, hi everyone. Thanks for coming along to this webinar on managing comorbidity, tips and tricks for adapting practice in a changing environment. So my name's Logan Harvey. I'm a clinical psychologist and a PhD candidate at the Matilda Centre for Research in Mental Health and Substance Use. So I have a clinical role in a public drug and alcohol outpatient clinic where I work with patients with comorbid substance use and mental health problems. And I'm also doing some research looking at trauma and substance use, in particular the relationship between post-traumatic stress disorder and complex post-traumatic stress disorder and substance use issues. So before I start, I'd just like to begin by acknowledging the traditional owners of the land on which we're all on during this webinar today. I'd also like to pay my respects to the elders past, present and emerging. So what we're going to be looking at today is some information around comorbidity, particularly around comorbid mental health conditions and the impact of these on substance use treatment. I'm then going to take you through some information around strategies to better engage consumers in the current environment where our face-to-face contact's limited. We're going to look a little bit within that at risk and how we might need to look at our risk assessments and monitoring risk a little more. A lot of that information that I'll be using there is really quite anecdotal, and it's built on the work that my colleagues and I have done at the moment with our own clients. So it is based mostly on clinical practice at the moment because everything is so fresh and new. So when we're talking about comorbidity, we're referring to the presence of two or more conditions at the same time. So this isn't necessarily just substance use and mental health conditions. There are obviously a range of physical comorbidities and other comorbidities, but today I'm really going to focus in on mental health conditions that co-occur with substance use disorders. So these conditions may have a causal relationship where one may cause the other. For example, where someone may develop depression and then subsequently start drinking alcohol and develop an alcohol use disorder on top of their depression. But they can also coexist, and that might be a result of a bunch of different factors that underlie both conditions. So it's not necessarily as simple as one condition leading to the other, and that's a really important thing to consider in terms of treatment, because resolving one condition won't necessarily resolve the other. On top of that, while most people will experience a mental health condition in their lifetime, not everyone has a fully diagnosed mental health condition, and often people with substance use conditions may experience a variety of mental health symptoms that aren't necessarily captured by a diagnosis or meet the criteria for any one diagnosis. So it's quite common for people to experience substance use problems along with a variety of different mental health symptoms. Now we know that comorbidity is really prevalent in AOD treatment settings. Within the population of people attending AOD treatment settings, up to 75% will have a comorbid mental health problem, which is quite a high number. On top of that, we know that 1 in 3 will have multiple comorbidities. So this is a really important factor for anyone providing AOD service to consider. In the general population, anxiety and depression are the most common mental health conditions, and this is reflected here as well because they are two of the most common comorbidities for substance use issues. But on top of that, PTSD, post-traumatic stress disorder, and personality disorders are also really uniquely represented in substance using populations. Comorbidity and mental health comorbidities in particular really will complicate treatment for substance use problems. And this might be as simple as symptoms of mental health problems impeding or impairing the ability of the person to engage in substance use treatment. But on top of that, we know that there's a bunch of systemic factors that can lead to barriers for people getting treatment. Interestingly, though, we do know that people with comorbid disorders can benefit from standard substance use treatment, and there is certainly lots of evidence that even with mental health comorbidities, people can improve their substance use with treatment. But we know that more sustainable outcomes tend to occur whenever there's integrated care available. our system at the moment often results in these kind of detached silos of treatment for people, where they might be bounced between a mental health service and a substance use treatment setting, never quite getting both sets of needs met, and often not feeling like their needs are really being understood or heard. So when we talk about integrated care, we're really talking about treating multiple issues in the same episode of care with the same clinician. So for example, this might be treating some symptoms of anxiety or depression while someone is seeing a drug and alcohol counsellor for their alcohol use. So comorbidity is already quite problematic, and there's already some barriers there and some issues in terms of getting treatment. But the current situation with COVID-19, I guess, is throwing up a variety of different issues for everyone, not just people with comorbidities. We know at present that everyone is kind of experiencing changes in their activity levels, and a lot of people are having decreased activity. There's people experiencing changes to their diet and nutrition. Some people have not got the access to a well-rounded diet at the moment because of financial issues, but other people as well are finding that because of the disturbance in their routine, they're just not eating as regularly, and there's a lot of snacking and things like that going on through the day. So changes in your diet and nutrition are also becoming quite problematic. Financial pressures are really prominent, and social isolation is obviously very key at the moment as well. Having excess free time is an interesting one, because for some people this has been really useful and somewhat of a relief, but for other people it's actually really problematic. To lose structure and routine for some people is actually quite destabilizing, and as a result it can create just more time where people have got to try and actively cope with what's going on for themselves. Coupled with that, we've seen this kind of loss of contact and disruption in services as well. Lots of services have had to reduce their availability or switch their service approaches. So clients at the moment are having some interruptions in their service delivery. Beyond that, for people with particularly anxiety and trauma-related issues, this kind of increased sense of threat and danger that's hanging over everyone is quite problematic. There is a really kind of underlying level of anxiety for everyone, I think, at the moment, in that there are some dangerous things happening around us, and everyone's a little bit more agitated, a little bit more tense. And that underlying sense of threat can be very triggering for people with trauma histories and also for people with anxiety disorders. I guess finally, at the end of what's happening at the moment, we do have people losing their lives, and that's also going to impact members of the community now. So people will be experiencing grief and loss issues in a variety of ways, and that's likely to kind of continue on for a little while now. So within all of these impacts, I mean, there's a large variety of impacts, and we're not even fully aware of what all the impacts will be at this stage, but we can see already that there's a bunch of factors there that are really going to impact on mental health. We don't have a lot of clear evidence just yet of what the mental health impacts are looking like. We do know that there has been some increases in certain symptoms of general psychological distress in the community, and there's already some data coming out about that, but it's a little early for us to know exactly what's happening there. We can get a pretty clear picture, though, that there's going to be some impacts on mental health in general, and so for people with comorbid mental health and substance use issues, this is going to be particularly important. I think a useful way to think about how the current situation might impact on people with comorbidities is to kind of look at these 5 areas here. Now, there are a variety of other areas you could think about, but I think this is a nice little snapshot of things to consider, and particularly a way to start to guide the development of some interventions. I've touched on most of these already, but I think this is a nice little summary to collapse some of the broader impacts that are going on. And it's a kind of a useful way to start to check in with your clients as well. So if we're thinking about this at the moment, we've got a pretty strong sense that people with comorbidities already face some challenges when they're trying to engage with treatment. And on top of that, now we know that everyone is facing some extra challenges. So people are likely to have some increase in certain symptoms, things are likely to be a little bit disrupted, and it's possible that there'll be some interruptions in services as well, which may also lead to some exacerbation in symptoms for some people. Given this, all AOD service providers probably need to have a really careful think about how we are going to adapt our models of service, because at the moment we've all had to pivot quite quickly and be quite reactive, and I think it's important to think moving forward how we may need to adjust things and vary our normal way of working to make sure we're still meeting everyone's needs. So when we're thinking about this, the first thing I think is important is that we all kind of take a moment to reassess what's happening for each individual client we're working with. It's very easy to make assumptions about how certain people may be coping, and when you've been working with a client for a long time, you may have a strong sense of what their normal strengths and weaknesses are, and you may kind of then make some assumptions about certain people coping better than others. And what we've already noticed is that this is impacting different people in different ways, and it's really hard to predict for a lot of people who might be destabilized by what's going on and who won't be. I've already been quite shocked by that with some of my clients, noticing that for some of them, they're doing quite well when I really didn't think they were, and I expected things to be quite unsettled for them. So I think looking at the fact that the situation has changed, everyone's treatment and support needs are going to change as well. We really have to spend the time speaking with our clients about their concerns and expanding that check-in we're doing with them to really ask more questions and get a strong sense of what their priorities are at the moment and what's really happening for them. A big part of this is going to be screening for common mental health symptoms. The reason being that at the moment, things are likely to change over time, and even if someone did react quite well to what was going on initially, there may be some changes occurring over the next few weeks and months, particularly now if we're going to start opening things up a little bit more. That's also going to change the landscape again. Doing some regular screening for common symptoms is going to be quite a useful way of tracking progress, and also trying to capture emerging mental health issues early so that they can be addressed early. Once we have a stronger sense of what's going on for people, it is really important that we start to then think about how we're actually going to provide our service. So at the moment, I think pretty much everyone has just pivoted to doing a lot of phone contact. And that's been quite reactive, and it's captured most people, I think. Some people are doing video telehealth sessions, Zoom and Skype and things of that nature. And I guess we're all going to be limited at the end of the day by our service requirements and by the systems we're working in. But I think a real key here at the moment is around flexibility. It's likely that we're all going to be working with a mix of modalities at the moment, but I think it's important to really explore each different modality within your service to see how you may be able to blend them together. Face-to-face care is still an option, but also things like email or text-based contact can be quite useful at the moment. I guess the key here at the moment is really going to be to provide whatever adjustments you need to in order to maintain contact. I think the important thing for everyone right now is going to be around maintaining contact with our clients through this process so that at the other end, we are still engaged and able to continue on. This is probably going to mean a blend of those different contact modalities. And it may also mean that there's a change to the frequency and duration of contact. Now, ways that I've sort of been looking at this lately have been around blending phone contacts with email contacts, sending through emails between sessions to touch base with people or to provide resources, inviting clients to have some email contact between sessions, and particularly looking at things like perhaps having more regular contacts, particularly for socially isolated clients, but maybe briefer in duration. So you might have 2 brief contacts with a person in the week instead of 1 longer contact. On top of that, this is a really important time for us all to kind of reconsider our use of e-health and technology-based interventions, particularly if you're someone who hasn't used these a lot. And I'm certainly in that category. I haven't used them regularly in my work previously. But I think they are a real strength right now in terms of being able to supplement what we're doing, or even replace things where there are service gaps occurring. There's a large variety of these out there. Some are based on apps, some are based on websites. And I think it's important that you explore the different opportunities that's going to present at the moment. It's important to also consider whether you can actually use these in a guided way, because I think that's a really useful option where you're actually working through activities with the client or being really involved in that process with them. I definitely recommend that everyone thoroughly explore the different apps that are out there and the different websites themselves, so you've got a really good understanding of what the client's actually going to see when they're opening and working with these. But I think even if they are used as homework tasks or between session tasks at the moment, they have a lot of value right now. And it's probably something that we all should be doing more often normally, given that there's such a growing evidence base for these interventions. But this presents a really good chance for us all to start to really integrate these into our normal service. We're all going to have to get a little bit creative with that. And I think maintaining our wellbeing for all of us at the moment is really going to take some additional work. I think this is a really important thing to discuss with clients. For now, I've already had quite a few people who've sort of said to me, I thought I was doing really well, but things are backsliding now. I think we've really got to talk through that point with everyone and really explain that at the moment the burden on everyone is lifted. We've got a lot more that we're dealing with, and so we're going to have to put in extra work and cope more to kind of maintain ourselves. This means that whatever people were already doing might not be sufficient anymore. Those original strategies, support, services that were in place might not quite cover things at the moment, or they might not meet all of the needs. So having that conversation with clients is a really important starting point so that everyone can kind of be a little bit more aware that they may need to change things up. On top of that, I think it's really important to start to have a think with each client about how you might be able to target some issues that emerge in each of these areas. I think social isolation is a really interesting one at the moment. Some people are finding themselves to be far more isolated. And I think this is really having an impact on people who did rely on professional services for that general human connection. If you're no longer attending a dosing clinic really regularly, or you're no longer attending appointments every week or seeing support workers, that's going to have a huge toll very, very quickly. Not everyone has been able to isolate with family or friends or other people at home. Some people are alone in apartments, and that's proving really problematic as well. So we all need to be really conscious of that and spend the time to really check in with each individual client about who their actual connections are at the moment. Wherever we can, we've got to find some ways to encourage reinforcing those connections. So talking through about how we might be able to maintain connection with people living elsewhere, or also looking at how we may be able to maintain connection with different services. On top of that, there's going to be occasions where we've actually got to look at increasing connection, because not everyone will have a network there that we can start to build on. So often when we're doing this, we may have to start from the bottom up and start with professional contacts, and that might be yourself. It might be about us being a little bit more available for some people at the moment, and then gradually expanding that out over time, looking at different support services and trying to get things linked in that maybe weren't quite there. A loss of routine, and whether that's linked to a loss of work or just a loss of general routine, can be really detrimental as well at the moment. For some people, the loss of work has been really damaging because it's taken away that sense of accomplishment and achievement. But on top of that, it does just really disrupt your day. It's much, much harder to maintain your self-care if you're not having to get up every day and go places and see people. So we all need to start to map out, I think, with our clients what they're actually doing each day and week by week, and what their week is looking like. If they're not leaving the house at the moment, what are they doing and who are they seeing? If they are at home all day, what are they doing in that time? Are they just watching TV, Or are there other things that they are accomplishing? Are there little tasks and activities we can set and design that we can check in on each week to keep people kind of focused and engaged on something? Again, do we need to use our appointments or our contacts with people to reschedule these things? Start to build in a bit more routine and structure. It might be that having 2 appointments a week is the start of a new schedule and that you can build on that. Or you may need to explore other options for what people can do. This can obviously include just some basic behavioral activation, getting out and going for a walk, things like that. Exercise is going to be really important. But I think for a lot of people, just having some set tasks in the week and in the day is going to be really important as well. Self-care is an interesting one because at the moment we're not having a lot of face-to-face contact necessarily, so we don't get a good sense of how our clients are traveling. It can be really telling, I guess, if someone comes in to see you one week and they're not looking as good, if you can tell they haven't brushed their hair or they've got dirty clothes on, things like that. If we're only having phone contact at the moment, we don't necessarily get that information. So it is really important to check in around self-care and really get a sense of, are people looking after themselves at the moment at that really basic level? Go right back to, sleeping, eating, grooming, and just check in with that. Obviously, everyone is spending more time in their pajamas now, and it's not necessarily a bad thing, but we do need to make sure that doesn't become a sort of slippery slope to us not looking after ourselves. It might be important there to highlight some small actions people can take and to set some ground rules, just to help people maintain that basic level at the moment. Managing the sense of threat and the kind of anxiety that comes with that can be a really tricky one. For some people at the moment, they've really withdrawn. Supermarkets, may have been barely achievable and now they're not. Things like that. Being out in public has become a little bit more difficult. So I think it's really important to reassure some people at the moment that everyone is feeling that to an extent, that there is a sense of threat and danger around. And if someone has experienced trauma in their life, they're going to be really sensitive to that, and it's going to activate their anxiety a lot. So providing some reassurance that that's part of what's happening now for everyone, and it's not just them that's experiencing that, is going to be really important. Looking then to find some mechanisms of safety is going to be really crucial for those people. So it may be that the home is the only safe place that they're experiencing at the moment. So finding something like that as a starting point can be useful, but then really trying to broaden out and find some other safe people or some safe activities they can do that generate a sense of safety when they're out and about. It might be listening to a particular song, practicing some breathing or some skills and strategies, or just maintaining connection with other people, calling a friend while they're going to the supermarket, something like that. Having another look at those any strategies really that can help generate a sense of safety is going to be really important. The loss of supports, as I mentioned, is a really important one for us all as clinicians to consider, because if we know that there's a variety of services involved with someone, we can make the mistake of assuming everyone else is covering something. It's important to check in with each person we're working with as to which supports or services are actually seeing them at the moment. If everyone is pulled back and is just having brief occasional phone check-ins, people are going to be very unsupported right now. So there might be a bit of coordination that can go on there so that we can actually touch base with different services and work out, well, who's actually calling who and when. And this can be really, really crucial around some of that general wellbeing stuff. We know that the public in general are not seeing GPs and doing standard healthcare at the moment. So for people to maintain mental health, it's going to be a little more difficult. This might include things like people not renewing scripts, not getting new medication, all sorts of things like that. So we really need to check in about which services are actually involved with people. Are they still seeing them? Do we need to touch base and have a bit of a group call to talk through what support's needed? On top of that, if you're screening regularly for these mental health symptoms, you may find that you need to consider new referrals at the moment. And that's a tricky thing to do. So we do need to make sure we're calling around and doing the legwork to work out what services are available. Be very careful not to hand out numbers and refer people to services without double checking that they are open and functioning in a way that's going to help that person at the moment. I guess on top of all of this, it's really important to recognize that this isn't treatment as usual right now. We're not going to be able to do everything that we could previously do. We're not going to be able to follow our normal service approaches. We're not going to feel comfortable with this, and we're not going to feel as capable as clinicians because we're just not going to be able to cover everything. We obviously need to do our best with what's happening, but we've got to be really clear about the limitations that we're facing too. For some people, this might mean that we're going to be available to our clients, but we may not be able to do everything we had planned. This might mean that, admissions to residential programs, looking at detoxes, engaging with new program services, things like that are all going to potentially be put on hold and delayed. So whatever treatment plans or goals we had might not be available anymore. It can be quite frustrating, particularly if you've been really working towards goals. And so I think it's really important to have that conversation with clients around the fact that, our job at the moment is really to keep ourselves as well as we can and to let everyone get through this. And we can deal with the rest after. We've got to be kind to ourselves as clinicians, though, in looking at that, because it can be a little bit deflating if you have worked really hard with someone and then suddenly you're at a point where the best you can do is just have a phone contact every week when you know that that's not exactly what they need. So being really clear to touch base with colleagues and to really talk through what's happening with your clients at the moment is going to be really important, so that we make sure we're not taking too much of a burden, that we can spread some of that around through our teams and colleagues and through different referrals, and not try and carry that whole client's well-being ourselves. A big part of that stress at the moment, I guess, is around risk. Obviously, risk assessments are going to be quite service specific and situation specific, and everyone will do them slightly differently and cover different domains. I think these are some fairly general ones, though. Everyone's going to look at suicide and self-harm and harms and risks towards other people as well. We should all be considering overdose and substance-related harms. But I think at the moment, it's also really crucial to think about some of those vulnerability harms related to things like domestic and family violence. And that links in with child wellbeing quite well at the moment too. We know that with an increase in mental health issues at the moment, suicide and self-harm is going to be more on our radar. We're going to really want to check in around those things a lot more regularly, even if someone has never experienced problems in those areas before. On top of that, a lot of people are finding that if they are now having to isolate, we're spending more time with everyone. So if you're at home with your family more than you've ever normally been, that can increase tensions as well. And it also creates this additional vulnerability for people who are experiencing domestic and family violence. It's really important that we all check in around that, because not everyone is now going to be able to remove themselves from the home environment if it's not safe. On top of that, given the extra burdens on everyone at the moment, we do really need to be checking in to make sure that child wellbeing is being covered. We need to make sure that children are getting everything they need. Obviously, the school situation is quite difficult at the moment. People have been homeschooling and not everyone's had the resources or the ability to do that. If there are financial pressures and things like that going on, we need to make sure that children are being supervised, that children are being fed and having those kind of basic needs attended to. And again, this may be something that hasn't necessarily been on your radar with certain clients, but it's really important to check in about that now because the situation has really changed. Our risk assessments are always going to be based on the available information, only the information that we have, and they're always going to be geared towards making people as safe as we possibly can. I guess the dilemma at the moment is that the situation has changed quite a bit, so we don't necessarily have access to all the same information. And a lot of the things we may have done previously to try and put some safety plans in place may not be available or may not be as relevant anymore. So a really important step is that we all need to update our risk assessments for everyone we're working with. We really need to not make assumptions and not assume that a previous risk assessment is still valid, because the situation has definitely changed. If you're not able to see people, you've also got to be very, very careful to make sure that we're asking a lot more questions. As I mentioned earlier, you know, if you're seeing people face to face, you can get a sense of how well they're doing and whether the story they're telling you matches what you're seeing in front of you. If we're only having phone contacts at the moment, it can be harder to get those additional cues and that additional information. We really need to ask everyone all of our risk questions. Really step through and get the details, you know, double check things and clarify things as much as you can to make sure that you've got a good sense of what's really happening. On top of that, it's probably going to be very important at the moment to try and get collateral in some cases. So this might mean getting permission to speak to other service providers or speak to a GP, you know, things like that. Clarifying, are people still picking up medication? Are they still taking medication? Are they still seeing all the services that they're saying they're seeing? I think if we can get more collateral around that stuff at the moment, it's going to make us all a little bit more confident in our risk assessments. It's something that we should always probably be doing anyway, but again, we just need to make sure we're really covering those things at the moment. On top of that right now, I think it's particularly important that we go over these safety plans that we may have with our clients. Hopefully for most people, you'll have some sort of safety plan already set up. And I think it's important to just step through it again and double check, are they still happy with it? And is there anything else that they think they'll need to feel safe? You may find that when you talk through the old safety plan with them, some of that stuff might not be relevant anymore. We don't always update these as clinicians, and I think now is the time to do it, definitely. You really want to double check around those risk domains and clarify that everything you thought you knew is still relevant and appropriate. Getting that insight from the client as well about what's going to make them feel safe, and do they feel like they've got the information they need to manage risk issues when they come up? Who should they call? Where should they go? What should they do? Really making sure that's very clear for them, and always, wherever possible, providing that written safety plan for them. We've all kind of pivoted to phone and video sessions a lot at the moment. And some people have been doing a lot of phone-based counselling and work for a long time, but it isn't as comfortable for everyone, particularly around risk. That could be tricky when you're not seeing the person. So I think there's some important things to really do to set up those video and phone sessions. One really important thing is to always obtain the person's address at the start of the call. So really confirm where they are on that day. It's happened to me constantly over the past few weeks, where you'll call someone and they aren't at home. You know, they might be out in the car, they might be at the supermarket, they might be at a friend's place. We just don't know, and we've really got to clarify, because if you're not aware of where someone is, you're really not going to know where to send help, and that can become really tricky. For all of my clients at the moment, it's become quite standard, and they've all kind of adjusted to it and gotten quite used to it. You know, at the start of the call, we'll just check in, where are you today? You know, can I just double check the address where you are? And no one's really had any problems with that. I think it's important to plan with your clients around those sessions, to actually have the conversation with them that if you're going to have that sort of phone contact, it's probably not appropriate that you're at a friend's place or that you're in Woolworths. You want to make sure that, you know, at the time of your call, they know you're going to call, and that they've got a chance to be somewhere quiet and private. Trying to really coordinate with them that, okay, when I call at 10 o'clock, you know, you'll be at home and you'll know that you can go into your room to take the call. Second to that, it's very important to double check that they are actually alone and that they're safe to talk. So before you kind of launch into anything, you really want to double check, you know, are you okay to talk right now? Are you alone? Is there anyone else around? This is very, very important in situations where you know there might be domestic and family violence occurring. And my strong advice would be, in those situations, that you don't try to conduct any sessions over the telephone where possible, unless you're really, really certain that things are safe. Risk assessments and asking questions around that stuff, if someone else is overhearing, is really going to elevate risk and can be quite dangerous. So we need to clarify that stuff and really consider whether it's appropriate to have a phone session like that, where we're not sure who else is there or who else is listening. On top of that, we have to really have a plan for if a call is going to disconnect or drop out. If that call drops out, if that phone goes flat, and it's at a point where you're talking with someone who's quite distressed, you really need to know what to do, and they need to know what to do as well. Do you wait and call back? Do you call a different number? How are we going to manage that? An important point with that is if you've got a planned session with someone, just remind them to charge their phone beforehand. So they need to know where they're going to be for their appointment. They need to know that they're going to be alone and in a private place to talk. And they need to know that their phone is actually going to be working and that it's going to be charged enough for the session. If we're trying to expand our risk and safety plans at the moment, I think it's a really unique opportunity for us to start to explore safe people and supports a little bit more. Like I said earlier, this is something we should always be doing. Involving families and carers in treatment is a really useful tool. But I think now it's more important than ever. We've had an interesting kind of development, I think, for a lot of us lately, where we're probably being exposed to more of the family life and home life than we have previously. If you're doing video calls and phone calls and stuff a lot more now, you're overhearing things in the family home. You're seeing the family home for the first time sometimes, and you might even have situations where you're being introduced to family members. I think in most situations, that's something we can really encourage, and it's definitely a useful tool in risk situations, really exploring who else is at home with them, whether there's family or friends that can be brought into a safety plan, and ideally be given a copy of that safety plan so that that person also knows what to do if things do become unsafe. Our safety plans often do rely on contact numbers and other services, and we do just need to double check, as I mentioned earlier, that all the services we're recommending or that are listed on a safety plan are still available, because we can't guarantee that right now. It's probably appropriate for all of us to just call those numbers and double check that people are still working the same hours, or that they are still in the same locations, or that they are still able to provide the services. We might also, for some people, need to provide a bit more regular care. If someone's not doing well at the moment, it may be that we need to have regular contact with them. It could be a short-term measure, but seeing them a couple of times a week may just provide that kind of anchoring, grounding contact that they need. And it also give you as a clinician more of a sense of what's going on, particularly if no one else is involved in their care at the moment. You can get creative with this, doing that stuff around more frequent, shorter contacts, having a phone contact, but also having an email contact, or having 2 sessions a week or more, even if possible. Trying to be really flexible around that so that you're able to kind of better manage that risk right now, given that the situation is not normal. There will certainly be some situations, though, where we can't actually really properly assess or manage risk over the phone. And I think we should all really still consider at the moment whether we can see people in person. AOD treatment services are essential services, so it is quite appropriate to see people face to face. Different services and different organisations are going to have different rules around this at the moment. But it is quite appropriate and quite possible to still maintain all the required social distancing, physical distancing measures, and see people face to face. An important part of it is going to be that you'll want to do a brief screen prior to your meetings. And this can be something as simple as, double checking, have they had any flu-like symptoms? Have they been tested for COVID-19 recently? Are they awaiting results? And whether they've been around anyone with flu-like symptoms or around anyone who's had a positive test for COVID-19. That can be an initial step to help reduce our risk a little bit. Practicing hand hygiene, sanitizers, hand washing at the start of a meeting or a session. Adjusting your meeting rooms, trying to meet in a larger room or meeting outside is really useful. We're doing a lot of our sessions at the moment in big meeting rooms or outside. That gives you that chance to maintain the physical distancing. And really, if we're maintaining that appropriate physical distance, we've practiced some hand hygiene, we've done some brief screening questions, our risk is much, much lower. So it is still definitely possible to do that at the moment. And I think we all need to think about it, because there are some people who, for a start, are not going to have a phone. They're not going to have a laptop that they can do Zoom sessions with. So for some people, face-to-face is really all they've got. And I think it's important that we're still available for those people right now. I think organisations are going to have their own rules, and obviously there'll be some people who might be more vulnerable at the moment as clinicians, and some clinicians won't be able to offer that, but still definitely this should be a part of our treatment. And now that things are starting to open up, hopefully it will start to be more a part of our treatment again, but I think it really needs to be considered. It's also a good opportunity for us to review our general harm reduction information and strategies. You know, substance use for everyone has probably changed a little bit at the moment. So double checking all that information again around substance use, because we can't assume they're still using the same things and the same amounts and the same frequencies. That will give you a chance to potentially provide some more targeted harm reduction information. And, you know, considering things like take-home naloxone and stuff like that, it's all stuff that we should always be doing, but right now it's more important than ever. Again, this is one of those areas where we don't want to make assumptions. Don't assume that people are just continuing on their regular pattern of substance use, because it probably has changed. Some people have found that they are stopping and reducing a lot right now, and other people have found that they've switched to different substances, or that they are just using a lot more. So we need to really clarify that and make sure that we're on top of that and that we're able to put some harm reduction strategies in place there. So I guess a quick summary, you know, it's really not treatment as usual at the moment. Comorbidity can be difficult to manage, but it is something we can all manage, and providing that integrated care in whatever way we can is always going to be useful. Screening for those common mental health symptoms and really monitoring that over the next little while is going to be really important. I think we all need to try and reassess our current treatment plans and what's happening with people. Be flexible wherever we possibly can. You know, we've seen all sorts of flexibility occurring at the moment that we never predicted. The government has suddenly become very flexible in lots of ways. So I think if they can, we can as well. And getting a little bit creative with what we're actually going to be targeting in treatment, particularly if you're not someone who has previously targeted comorbidity a lot. I think it's really important now that we all branch out a little bit. Having a look at those 5 areas of wellbeing will give you a good start point, and you can go through that with your clients and start to map out what are some of the areas that do need some work, and then designing some additional strategies there. Remembering that some of those e-health and technology-based interventions might be a really useful way to do that. In that reassessment, we've got to review our safety plans, we've got to update them, we've got to really double check. If you're not having as regular contact, or if you're not seeing people face to face and you used to, you're going to have to ask more questions and make sure we're not relying on any assumptions. Double check things, clarify details, try to get extra collateral wherever we can, and then really update those safety plans, make sure clients have a copy of them, make sure the client's happy with it and it makes sense to them and it meets their current situation. And then on top of that, I think, yeah, we've all got to recognize our limits right now. We're all just going to try and do our best. And unfortunately, we're not going to give everyone all the care they need right now. So being kind to yourself and to your clients around that is going to be really important. We are not going to do as well as clinicians, and our clients are also not going to do as well in their lives at the moment. So we've got to talk that through with them a little bit and recognize that for a lot of people, this will be a bit of a holding pattern, and it will be around just supporting and maintaining connection over the next little while until we can start to really roll out all of our previous treatment plans. In terms of some resources, the National Comorbidity Guidelines is obviously a fantastic resource for working with comorbidity. It's really designed for AOD treatment providers. You can go to the website I've listed here. They've got guidance around all the different specific disorders. there's worksheets, there's interventions, there's kind of example plans and treatment plans and things that you can look at. And there is also an online training package that you can go through. Lots of people are finding now is a good time to do extra training, so definitely have a look at that as well. On top of that, at the Matilda Centre website, we have developed a bunch of comorbidity booklets, which are also really useful. So there's 5 different comorbidity booklets there, which are really specifically designed to go over information around comorbidity issues for clients. So these are something you can give to your clients and share amongst some of those communities at the moment. And there might be a really useful starting place for working with clients to screen for some of these symptoms and look at the information in these to work out whether they do need some additional help around their mental health problems. So that website link I've listed there will take you to those booklets. And there's also some other resources on that Matilda Centre website as well that might be useful for clinicians and for also our clients at the moment. So I hope that has been useful. I'm very happy for people to contact me if they want to discuss further, or yeah, very happy to have any questions at the moment also.